Reduced reimbursement and the impact on oncology practices, collaboration opportunities for practices, pharma, and payers, operational improvement through new technologies. How are community oncology practices optimizing their resources to continue to provide quality patient care? And are there other opportunities for practice growth that remain unexplored? Join us to find out. In the Know starts now. Hello and welcome to In the Know, your source for insight and analysis on the issues that matter to our dynamic healthcare market. I'm your host, Gina Clark. Today, we get an insider's look at how community oncology practices are responding to growth inhibitors like reduced reimbursement and increasing competition. We will discuss what obstacles practices face as they work to implement efficiency tools like electronic medical record systems. And we will outline some options for how practices can address challenges like technology adoption, strategic planning, and payer relations. Joining us to address all of this is Matt Webb, Vice President for ION Solutions. Thanks for joining us, Matt.
Thank you. It's great to be here.
So, Matt, some of the country's largest oncology practices are members of ION Solutions and depend on the company for assistance with operational issues and education on clinical issues. From your discussions with them, what are some of the largest business or clinical obstacles that they face?
Well, from a business perspective, many of our practices are sharing concerns they have about reimbursement is a primary topic that we've talked about. Over the past years, they've seen a dramatic reduction in their reimbursement, both from private and public payers alike. So naturally, that leads into concerns about their claims processing, their billing processes, how they can ensure that they are maximizing their payments under the new reimbursement levels. So we spend a lot of time talking to our practices about billing. They also have concerns about practice management and just in general how to increase the efficiency of their operations within their practice. There's no one single solution that really is going to address the impact that they've seen or the reduction that they've seen in reimbursement. So it's really a holistic view that they're asking to take, for us to take in helping them with and addressing challenges that they're seeing in their practice these days.
Those who casually monitor the industry may be aware of the reimbursement decline faced by community oncology practices. What they may not understand is how severe a drop-off many practices have seen. How are the practices addressing these issues?
As we've said, the reimbursement decline has been significant over the past several years, to the point where many of the practices really just are facing issues of remaining viable and keeping their practices open. So we've encouraged our practices to take a very holistic view in addressing these issues. So the practices are really looking comprehensively across all of their business processes, across all of their technologies within their practice to really address the decline in reimbursement. Again, there is no single source of correction within the practices that are going to address the dramatic declines that we've seen in reimbursement. So we're really working with them to address a broad range of areas within their practice. That includes inventory management. It includes their claims processing. It includes just generally how they are viewing their financial health within their practice and the tools that they're using to get a really holistic view of where they may have pressure points or pain points within their practice that need to be addressed.
These are dramatic changes inside of practice. To what degree of success have they had with these tactics?
We've been very encouraged so far by the success that we've seen within the practices who have started to address these issues. It's really dependent, one, on the practice having full transparency into where they are experiencing issues. The other thing is creating buy-in across the entire practice and across all of the physicians within the practice to really ensure that they have a collaborative and comprehensive approach to addressing the issue. So we have seen a lot of interest from the physician practices. Over the past year, we've seen a dramatic increase in their interest in technologies like electronic medical records, for example. And a lot of physician practices are really taking that leap now to adopt some of those technologies to really drive more efficiency in their practice, both from a clinical management perspective and from a just general business process perspective as well.
So what about internal practice processes or discipline? I hear many practices have begun integrating strategic planning processes into their business. How could this be further encouraged within these practices?
Many practices have begun to really put more discipline behind their planning process within their practice. I think really to encourage that across broader practices and across the industry, really looking for opportunities to share success stories from practices who have been successful in that with other practices who may just now be beginning to look at that. With ION Solutions and with our membership, we host a number of meetings for our members throughout the year. That really provides a forum for us to talk about business practices for our members to share with other practices, success stories that they've had. What are the things that they are doing to really improve their practice viability? So I think just looking for other opportunities similar to that will really help to share that knowledge across the broader oncology industry.
And you're finding physicians are coming to these meetings or educational opportunities willing to truly share, as opposed to maybe in the past feeling a little bit competitive or a little bit closed off about some of those things?
We've seen physician practices be very open in not only sharing, but also seeking, asking questions, being open to new ideas, to new technologies to address the issues and the challenges that they are having in their practice, yes.
Good to hear. So let's turn our attention to maybe a brighter area in community oncology, clinical and operational technologies and their ability to improve practice viability. How have you seen general economic challenges affect practices' mindset about technologies like electronic medical records, e-prescribing, and electronic practice management systems?
Well, we have seen an increased interest in those technology suites across our practices and the practices that we're partners with. Really the important thing for practices to first consider is exploring areas of their practice where they may not know that there's inefficiency or where they may not have full visibility into that. That's a good starting point. And a lot of these new technologies allow practices to really uncover areas within their practice, data within their practice that previously they may not have had visibility into. The great thing that we're seeing and that we're encouraging in the solutions that we're delivering to our membership is the interoperability across those technologies. It becomes really powerful when you can link information from your inventory system all the way through the entire process to the point where you get paid for the administration of that product by the payer. And a lot of the newer technologies are enabling practices now to have that visibility. A lot of the technologies now are oncology specific. Previously EMR systems, practice management tools were not necessarily customized to meet the unique needs of oncology. So we are seeing new technologies in the marketplace that do have that oncology specificity and are really targeted to that industry.
What barriers still stand in the way of broader adoption of these tools? I would have to believe that in some cases price would be, but maybe you can speak to that or any other barriers.
Sure. Price is a consideration. It certainly is a significant investment for the practices to implement these technologies, especially if they're looking to implement a suite of technologies to really maximize their value and the ability for those technologies to have an impact in the practice. However, the return on investment that the practices have seen from that can be significant. Really in being able to better manage your inventory, for example, through the utilization of an inventory cabinet. Drug spend can be one of the largest line items that a practice has on in their financial balance sheet. So really managing that inventory closely and tightly is important. Managing then that transaction all the way through to ensuring that you get paid appropriately and quickly for that product is also important. So when you can better control all of those transactions within the practice, the practices can really maximize their return on investment fairly quickly with these tools and technologies.